All right, so today we are starting a Q&A here with Dr. Amy and myself. I am owner of Fortress Physical Therapy. My clinic is located in Pineville, North Carolina, within our CrossFit Pineville gym community. So we have Bonnie here today. She is interested about getting some physical therapy services and just had some inquiry on some common questions that I receive from potential patients.
What about maybe other services you might offer, to help a person with pain in, other areas, your shoulder, your back, knee, or whatever? What type of services do you do there now?
Sure,
What
sure.
you offer?
So, not only upon the skilled physical therapy services, so that means um, skilled physical therapy is someone who has went to physical therapy school and they are able to properly assess and diagnose what is going on with the patient.
Mm-hmm.
So that needs to those type of approaches need to be performed by a licensed physical therapist in order to receive skilled physical therapy. Some other services that Fortress Physical Therapy offers is we can do solo by itself as well as incorporate into the treatment plan dry needling. Dry needling is becoming more and more popular these days, but literally with the clientele that I have right now, I probably dry needle about 90 to 95% of my patients.
Mm-hmm.
So that's one other aspect or modality that I can use in my toolkit to help get patients better. Another thing, we also incorporate any what we call spinal manipulative therapy. So not only is that directed to the spine, but also to like the elbow, the wrist, the knee, the hip, the ankle. So manipulation just means trying to obtain more range of motion within a stuck joint.
Oh,
So if I feel that it's deemed appropriate, then and manipulation can be very advantageous. So that can also be incorporated into the physical therapy treatment
mm-hmm.
or alone by itself. Some patients will come in and just get spinal manipulation and maybe some soft tissue work um, or maybe we go over a specific exercise and then they're out the door. Some other aspects that we also uh, advise and adhere to is cupping. So cupping is a great soft tissue intervention. It kind of resembles a little bit of massage. So the cupping is a great adjunct to those who can't maybe tolerate dry needling. It does the same effects alongside of dry needling, but sometimes patients are a little bit more sensitive to the insertion of the dry needle. So the cupping can do the same thing. Sometimes we leave the cups on there just statically in place, and sometimes we kind of move the cupping along the tissue that may be restricted. Plus, it feels good. So,
Oh,
um, another thing too that kind of recently came out is what we call body tempering. So body tempering is the use of an external load, and that load is typically cylindrical. So sometimes it could be a cylindrical piece of steel that's like 6 to 12 inches long, or it can be like 36 or 24 inches long. Weights can go up to 20 pounds all the way up to about 225 pounds. So this is another modality that we use to help passively strengthen our muscles, tendons, and joints, and also kind of get a little massage along the way as well. So we have these great adjuncts and necessary modalities that we can help provide our patients. But I think one of the big things that really hones in is exercise, movement. So I
movement.
can do all of this passive stuff per se, but in order for the body to heal and get better,
Mm-hmm.
you have to move.
Mm-hmm.
So any type of exercise. So you have to be proactive with your choice in order to,
Mhm.
live a better life. So,
Yes.
so
Now,
those are the main other services. One other thing before I forget is we do offer some personal training or wellness training sessions.
oh, mhm,
So those sessions are usually about an hour, and we discuss your goals and what you want to get out of fitness.
mhm,
Um, because nowadays people, I don't know how old you are, but um, as we age, our body tends to break down.
mhm,
So a lot of the individuals who are becoming more in the geriatric age, so 65 or higher, are more prone to fatigue, weakness, loss of
mhm,
balance. So that's one reason why through Fortress Physical Therapy that we want to provide these wellness incentives in order to
mhm,
prevent the body from becoming really deconditioned. So it's an individualized program that we can either meet one time a week, twice a week, or once a month and just kind of check in. But just to make sure we're on this health and wellness pathway together. So.